everyone, welcome to Healthy Kids Corner. It's me, Dr. Brooks, and today, as you can tell, I have a little bit of a different background. So I'm in our infant treatment room where we see children from ages 0 to 5, and today I have something super exciting. So I went ahead and filmed me working on a 6-month-old baby girl named Emma, and she is being treated currently, and I thought it would be really great for you all to see on film what craniosacral therapy looks like. A lot of parents want to know, a lot of parents have had bad experiences, or they think it's going to be painful, and it's really not. So first I want to open this up by just explaining what craniosacral is. Craniosacral therapy is a very, very gentle therapy. So let me first and foremost say that. It is not painful. A baby should not be uncomfortable, should not scream and cry. All of those things should not be happening. If a child is crying, they're typically hungry. So you'll want to give them a pacifier or feed them while the practitioner is working on them. Craniosacral therapy was developed by an osteopathic physician. So it is an osteopathic technique, if you will, that many chiropractors, occupational therapists, physical therapists, and massage therapists have learned how to do and incorporate it into their practices. The craniosacral system is made up of the cranial bones, which I have a nice little skull here to show you today. The dural tissue, which surrounds the brain and spinal cord like a wetsuit and goes all the way down and attaches onto the sacrum. And then lastly, the cerebrospinal fluid. So in everybody, not just children, because I know I'm talking about children obviously, but everybody's bones move ever so slightly. And the job of the craniosacral system is to pump cerebrospinal fluid. And how does it do that? It actually does it by the movement of the cranial bones. So the cranial bones kind of make this pumping mechanism, and the cerebrospinal fluid moves around the brain, down the spinal cord, and back. How the dural tissue gets involved is a lot of times the dural tissue that surrounds the brain and spinal cord gets wrinkled. And with many parents, I'll explain it like the sheets are wrinkled when you get out of bed, and so that tissue is wrinkled that's surrounding the brain, and all the nerves have to puncture through that tissue. So if that tissue is wrinkled, then automatically the nerves are irritated. Infants will exhibit symptoms such as colic, reflux, torticollis. As they get older, perhaps ear infections, trouble with sitting, trouble with milestones, and then of course our older kids with developmental delays, speech delays, apraxias, dyslexias, things like that. So what am I doing when I'm feeling? You'll see me working on Emma later in this video, and what I'm doing is I'm gently putting my hands on her head in the different areas. I'll start down at her bottom, at her sacrum, and go up through her torso, and then I'll get to the head. So what I'm feeling for, when I always say is, people always say, are you doing pressure, or are you doing acupressure, are you putting on points, are you massaging? It's not any of those things. I'm putting just enough, I'm gonna call it traction. So I'm tractioning the bone just enough so I can feel the movement. And what movement am I feeling for? So that movement that I'm feeling for is the pumping of the cerebrospinal fluid. So it feels much like a heartbeat, but it feels more, I'm going to say more swooshy. That's not really a word, but you know what I mean. And so when I feel the cranial bone, I'm feeling how elastic it is. So if I were to take a rubber band and I were to stretch it, it might stretch this far, it might stretch this far. And that's how the cranial bones work. So I want it to stretch just enough to do its job so it can pump that cerebrospinal fluid. So when I put my hands on the different parts of the skull, I'm just tractioning a little bit on that bone to feel how stuck is it, and can I feel that rhythm? Can I feel the cerebrospinal fluid moving? What if it's, quote, stuck? And that's what I'm doing, right? I'm working and kind of coaching the bone. This is the movement I want you to go into, and it will release. And each time somebody works on your child, each time I work on a child, I'm peeling back layers of an onion. And so each time I get to the core issue, right, the core problem, and we alleviate those restrictions as we move along. And this can be really, really relaxing. You'll see Emma, she's very relaxed, she's very happy, and the side effects, people always ask me that. There's really no side effects unless the person working on them doesn't know what they're doing, of course, right? That goes with anything. But I always say jokingly that the side effects are increased appetite and increased sleep. So sometimes that looks like crabby. So we actually have a nursery in our practice where the moms can go and feed, change diapers, all that fun stuff after they're done. I'm also not opposed to a woman breastfeeding or bottle feeding while I'm working, because that sucking really helps a child with the pressure that they're feeling. Again, that's not painful, it's just pressure. And so the only way that they can alleviate that pressure is by sucking. The other thing that you'll want to take into account when you bring your child in for therapy is you'll want to make sure that you're distracting them. So with infants, it's pretty easy. You'll see on Emma, we lower a mobile down and we have the mobile spinning. There's times I've worked on her and we fed her, we distract her with toys. As they get older, you can distract them with their favorite video on YouTube with your phone, or a favorite toy, favorite book, something like that. So distraction is the name of the game. When I hear parents say, we've tried it, but our kid was screaming, or it didn't work, or they weren't able to work on them, a lot of times it's just lack of really being able to distract them. With a lot of my children in my practice, they're nonverbal. I can't really explain it to them, right? I can't explain to them like I am with you what's happening. So we have to distract them. I do have lots of children, much older than Emma, that are on the autism spectrum, developmentally delayed, and don't really communicate verbally the way that you and I would, but they love coming in for craniosacral. They love it. I have kids that are out in the parking lot. As soon as they know that they're coming here, they're busting out the door and they are running in here as fast as they can. So I was actually trying to film this video earlier today and had one of the kids come in and running back in the hall, so I had to stop and start over. So anyway, I think I've covered just about everything. What the craniosacral system is, what I'm feeling for when I'm working on, more importantly, what to do to distract your child, what to expect after care, and then more importantly, what it looks like. So I hope you enjoyed the video with Emma. I guess I can tell you a little bit about her. She came in at 6 months old. She just came in 2 weeks ago. And at her 6-month evaluation, mom was told that she had torticollis, which is where the neck, the neck is stuck and rotated. So her head is like this and she can't move. Now, that's all she was told. So they were told to go to physical therapy and they couldn't get a return call from the physical therapist. So mommy did some research and found me. So when I saw Emma, she was, like I said, she's 6 months old. So some of the milestones, for those of you that are not familiar, are they should be doing tummy time because they're getting very close to, tummy scooting and crawling stages. She would not go on her tummy. When I did put her on her tummy, her face planted right into my table. She couldn't hold her own head up. The other issue was she would not sit up by herself. Usually at this age, they can sit up by themselves, or with just a little bit of help, you'd sit her up and she'd flop right over, which is also another not so great sign, right? Another thing she was doing was she couldn't hold her bottle or really hold anything up. She couldn't move her arms up. If I tried to move her arms up, she was restricted and she would pull them down. So changing her, putting her in outfits and things were really difficult. Washing her under her arms, very difficult for mom. And then the last thing I noticed was that her eyes are actually not even when she came in. So the sphenoid So the sphenoid bone, which is that yellow bone, I'm gonna get as close as I can here. If you can see it there, that yellow bone, that bone attaches, it's the only one that attaches to all the rest of the cranial bones. So it's one of those that's I always call it my problem child. But the sphenoid it has its little wings and it can twist and turn and go forward and back and tilt. So with Emma, hers is very twisted. And so my hopes are, as we work with her over the next several weeks, we'll start to see some evening of the eyes. So what does this all mean? So she can't sit up and she doesn't like to be on her stomach, and what it means is she's already delayed. At 6 months old, she's already developmentally delayed. And that's a big deal, because if she won't go on her stomach, she won't crawl. And if she won't crawl, she's at risk for dyslexias and other disorders, learning disorders. So we really, really want her crawling and really, really want her developing her upper body strength. I am happy to report that after her second week, she sat up by herself. She held her own bottle. She can roll from her back to her tummy on her own and push up and hold her head up. So she's doing really, really good. You'll see her on the video. I believe I have her sit up. I'm gonna go ahead and clip in the video now. If you're a parent, you wanna learn more about our practice, you can visit our webinars once a month that we do. If you're a doc, you can also attend clinician webinars. You can find all those webinars listed at dramberbrooks.com under education. You can also follow me on Facebook at Whole Child Wellness. I post lots of great information for parents. And also on Twitter, Whole Child, the number 4U, and of course here on YouTube at Whole Child Wellness. My practice website, in case you want to look at that, this website is mychildwellness.com. I really hope this video has helped not only my patients that are coming into the practice or are in the practice, but those that are seeing other practitioners around the world. Thanks so much. I'll see you soon. Bye. So this is Emma. When we work on babies, we usually use the mobile, and Mom is here, of course, standing by with food. Emma came in with Torticollis, right? I actually, just before I turned on the recorder, I had her sit up, and she has not been able to sit up by herself. Because of her Torticollis, she doesn't have a lot of upper body strength, so going on tummy time, pushing up, sitting up by herself without her kind of head lagging has been an issue. And you're the perfect little baby. So you're just going to kind of see me going from the bottom to the top, from their sacrum up. She likes to show off that she can roll on her stomach as well, right? She was showing us that skill set last week. You can, go ahead. So when I'm working, you're not pushing or pressing, you're really, really gentle. So I'm just using enough, I would say, weight or pressure just to feel the bone moving. And because I'm feeling for that dural tissue, that tissue that surrounds the brain and spinal cord like a wetsuit, it really just feels more like tug of war. It's the way I describe it to parents is when I go to feel it, these bones should move ever so slightly. And if they're not moving, it's that dural tissue that's restricted. And it's a tissue that can get kind of wrinkled. And when it gets wrinkled, all the nerves have to puncture through it and go to the rest of the body. So that's why they tend to get irritated and irritable and all that fun stuff. So most babies after this will be hungry and sleepy. Some do really great feeding during or sucking on a pacifier or a mom's, or breastfeeding on mom, or sucking a finger or something. And that's really because intracranial pressure gets a little bit increased as I'm working, and the sucking takes that feeling away for them. So it works really nicely if they want to eat. And a typical treatment time will be about 30 minutes each time I see them. So oh my gosh, this is the first ever time I've seen this. I just get too excited. When did she start holding her bottle?
Well, barely today.
I'm so impressed. Look at what a big girl you are. Like most babies, they like it when we get very excited, right? I know, I'm derailing you from eating. I'm going to go back and check her shoulders. She had a lot of restrictions through her shoulders that I believe were keeping her from pushing up on her tummy, holding her bottle, things like that. And they can get those restrictions mainly in utero or during childbirth. And one of the common things is parents will often have trouble dressing them or bathing them under their arms and things like that. So it's always something you want to watch out for. The bone I'm on right now is the sphenoid, which is the yellow bone that touches all the other bones in the system. So this is the one that, when it's twisted, can give us the illusion that her eyes aren't sitting at the horizon. And I've already seen her eyes looking a little bit better. They're not perfect. This is one that kind of feels funny when you work on it, because they can really feel this. Where do you want to go, Angel?
She just wants to be grabbing stuff.
Emma did not come in with the typical plagiocephaly, which is flattening, flat spots, the medical term for flat spots, basically. And typically when they have torticollis and they don't want to turn or cannot turn their head, they will develop flat spots from laying on the same side all the time. So there's some things that we're a bit delayed in kind of what her motor skills are, so she's making up for lost time, that's for sure. On the back of the head, the occiput, which is where I'm at now, this tends to be one of the tighter points with babies like Emma that have torticollis. There she goes, showing us her moves. So when we put her on her tummy last week, when she first came in, she actually face planted. She couldn't hold her body up. And as you can see, she's just doing a great job. Emma. Hi. Look how big you are. Can we roll back over and do some more work? Are you ready? I know, do you like my necklace? It's pretty big.
Grabbing.
I know. Okay, let's see if you can sit up. Okay. Emma. Here. Oh, you're so big. You're too big. Good work. I'm super proud of you. Yeah. I think you guys have been working at home on this, huh? And you can shake a toy. You can multitask. You want to learn more about our practice, you can visit our webinars once a month that we do. If you're a doc, you can also attend clinician webinars. You can find all those webinars listed at dramberbrooks.com under education. You can also follow me on Facebook at Whole Child Wellness. I post lots of great information for parents. And also on Twitter, Whole Child, the number 4U, and of course here on YouTube at Whole Child Wellness. My practice website, in case you want to look at that. This website is mychildwellness.com. I really hope this video has helped not only my patients that are coming into the practice or are in the practice, but those that are seeing other practitioners around the world. Thanks so much. I'll see you soon. Bye.